Do, 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 do. Do, 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 do.
Hi, welcome to Vitamin Junkies. I'm Jennifer Lyle.
I'm Dr. JJ.
And we're addicted to good health. Today we're tackling cellulite.
Cellulite.
Everybody has it. Well, women have it.
Most
Even the
women.
stars you see on the front of those Enquirer newspapers. Britney Spears, circle, look, she's got cellulite.
Poor
It's not
Brittany.
fair.
It's a
Poor
tough
Britney.
life.
It is.
It's a tough life. It's a tough life.
But before we get into that, we're going to look at what JJ's taking today.
So what I am taking today is something called CLA, conjugated linoleic acid. This is a neat little product that has some pretty good studies behind it, which is kind of neat. So basically what you do is you take this before every meal, and it helps you disperse your abdominal fat. So it allows you to get rid of your abdominal fat. I know we're on the topic of cellulite, but I figured CLA, abdominal fat, similar but a little bit different. So anyway, so this is kind of neat stuff. And what I find is when this works really well. But the trick is two things. One, you've got to take it in a high dose. So you have to take 6 grams a day, so 6,000 milligrams. So 2,000 milligrams with every meal. So that ends up being 3 meals, 6 over the day. And also you want to be very careful about the form that you take, because there's different chemical configurations to CLA. One form is the form you want that allows you to disperse the fat in your abdomen, which is good. And the other form, unfortunately, actually decreases your insulin sensitivity and actually increases the abdominal fat. So you want to make sure you don't get a cheap brand of CLA. You want to get a good quality source for that. So that's it, CLA.
So it's important then to consult with a naturopathic doctor because they know the good stuff and they can recommend a good product for you to consider taking. Now, women are often so body conscious, and I mean, even I'm body conscious, and
You know.
looking at cellulite, I mean,
Never.
something that always concerns us. So can you tell me what exactly is cellulite?
Okay, so basically cellulite is really a circulatory issue. What happens is that you have fat pads, it's mostly along the legs, that have almost become isolated and are really lacking circulation getting to them. And as the cellulite worsens, you start to get a lot more fibrotic tissue around it. So you almost get that cauliflower kind of clustered area of fat cells. So it's really circulation. So there's a lot of things you could do for that, and one of the things is mesotherapy.
Very good.
Yeah.
Now, why is it that women get cellulite more than men?
There's a hormonal component. Definitely there's a hormonal component to it too. Also levels of activity. It's not necessarily to do with women or for men, but it's because women, it's mostly because of the hormonal component.
Now, you mentioned mesotherapy as one means of getting rid of it. Are there other natural approaches people can consider as well?
Yeah, there's some supplements. I'd head more for cellulite, I'd head more towards chromium. Exercise, definitely. As I mentioned, it's an issue of circulation. So exercise, that's very important. You want to get your blood moving. Massage, so any way of getting the circulation to the area would be wonderful. So massage would be good for that. Also, what all my patients do when they come in for any type of body fat cellulite treatment is I have them get a handheld massager. So that's basically you'll just rub it over the area, and that increases circulation. So that it helps to actually tone the area. Dry skin brushing, same thing, drives a lot more circulation to the area, so that's wonderful for that. There's some creams too that you could get that help, some cellulite creams.
So for the cellulite creams, is it actually the active ingredients, or is it the action of rubbing and massaging then that is?
It's more the active ingredients, but definitely the action of rubbing and massaging helps because you drive a lot more blood flow to the area. So some very interesting stuff, definitely, yeah.
So you mentioned mesotherapy. Can you explain what mesotherapy is?
Okay, so basically what mesotherapy is we're delivering really small doses of vitamins, minerals, homeopathics, and herbals directly into the fat cells. In this case, we're putting them directly into the fat cells of the cellulite. So in our demonstration later, you'll see we're really injecting along a grid, and we're putting the treatment exactly to where the fat cells are. So this is probably one of the best things I've seen for really getting rid of persistent areas of stubborn fat.
Wow. Now, once you get rid of cellulite, does it come back? Like, is it gone for good?
Once you get rid of it, it's not gone for good. You have to maintain a healthy lifestyle, you have to maintain a healthy diet, you have to exercise. You don't have to continue for mesotherapy forever. Most patients, once we fix their mesotherapy, once we fix their cellulite, they're usually gone. We haven't seen them in a while. We may see them, I don't know, once in a blue moon, just for a touch-up, but for the most part, as long as they continue to be active, they do their dry skin brushing, they do their handheld massage, they watch what they eat, they're healthy, they exercise, then usually it sticks. It works very well.
So you're really coaching them as well on lifestyle changes, not just the mesotherapy technique itself.
Yeah. With anything to do with fat pads and weight loss, there's usually not a magic bullet, and it's usually not just one thing. It's an ensemble. It's diet, it's exercise, it's supplements, in some cases mesotherapy, it's stress management. There's a whole, it's the whole ensemble. It's the whole picture.
Very good. So let's go take a look at these babies and,
All right.
and give it a go.
Let's work on Jen's thighs. Woohoo! Okay, so Jen has very kindly volunteered her legs for our cellulite treatment, although Jen has very, very mild cellulite, if not absent, and she's not mic'd, so she can't rebuke this. Anyway, is it rebuke or rebuke? Rebuke? Anyway, you know what I mean. So basically when we're doing a cellulite treatment for mesotherapy, we're going to put a few things in it. So as I fill these things, pretty much I glove up here, these handy dandy little gloves, and we're going to fill a syringe and we're going to put in some phosphatidylcholine, we're going to put in some carnitine, and we're going to put in some procaine. And then what we do is we grab a syringe and then we grab a little needle, we attach the needle, and then we fill it. So some of the main things is phosphatidylcholine. So here I'll grab a little bit of that. So I'll fill that into my syringe here. We're going to grab, as I mentioned before, we're going to grab some procaine. And lastly, we're going to use some carnitine. Okay. Before we inject Jen, we're going to do two things. We're going to use a much smaller needle. So I'm just changing needles right here. You can barely see this on the camera, but the needle is tiny. I almost have to squint to see this needle. So we change to a much lighter needle. And also what we do on the area that we're injecting, we're going to do some vacuum massage. So basically this is a suction device that drives a lot more blood flow to the area. So as I mentioned earlier, is that cellulite is really a circulation issue. So by increasing the blood flow to the area, it helps improve the cellulite and get rid of the cellulite. So, so basically in her case, we're going to do some vacuum massage, and also when we inject, it's also going to allow for better absorption of the things we're injecting in. So we're going to do that now. Is that too painful? Okay. So some people find this a little bit tender, other people find that it tickles a bit. Kind of depends on the person. For the most part, it's not very painful. And you find it's getting much redder than the other side. So that's basically just a suction device. We're trying to drive as much blood flow as we can. Okay, so usually a whole treatment's about an hour, so I really just did one side. We'd probably spend about 10 minutes just working on the area so it's nice and bright red, so we increase our absorption as much as possible and get a lot of blood flow to the area. So in this case, I just did it for a few minutes just to illustrate what we did here. So then the next thing we do, which is very important, whenever you're injecting into the skin, you want to make sure the area is as clean as possible. So we take some hydrogen peroxide and we clean off the area. So plus we just put some the massage, the vacuum massage lubricant, just to make sure that the probe slides a lot better. So we'll clean that off with some hydrogen peroxide and it'll clean off the area before we inject. Okay, now comes the injection part. This is the best part, the part you've all been waiting for. So basically what we do when we're doing a cellulite treatment, we're basically going to be injecting in a grid roughly every inch or so. Grid across, all the way down. So we work all the way down from the buttocks, all the way down to just before the end of the knee. In the case of Jen, she doesn't really have that much cellulite. She has a little bit of sagging skin, so it's more of a preventative treatment to get a lot more blood flow to the area. So what we would do is, I'll just demonstrate a line or two, is basically we pinch the area very hard, because we want this to hurt as little as possible, and then we just gently inject. So we're just going in at a 90-degree angle, and we're injecting in that nice mixture I made to increase the circulation. So one of the reasons why this works so well is because we're doing so many injections. we're able to really deliver the area, the treatment to areas that have very poor circulation. So I'm not sure if you're going to be able to catch all of this on the camera, but really what I'm doing is a grid, right? So I'm going up and down about an inch apart. There we go. So probably she's had about 20 injections. So I did doom, 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 doom all the way across, about 10 here, about 10 there, and I'm just going all the way down her leg. And then sometimes we get a little bit of blood, not much in her case, and then we just clean off the area and we just keep going.
Wow.
So should I get a gurney? I think she needs a gurney. It wasn't that bad. It wasn't that bad.
The injecting, the massaging part tickled, but the injection, like when you said you would pinch to do the injection so it wouldn't hurt so much, well, the pinching didn't hurt, the injecting hurt, and I can still feel it, and I'm actually sitting rather uncomfortably here. So anybody who does consider mesotherapy, be warned.
Yeah, but see, this is different in your case because really you don't have that much cellulite. You mentioned you have a little bit of sagging skin, but the reason that you're feeling it is because you don't have that much fat to remove there. That's a good sign. Oh, you're welcome. So that's a good sign. It means that you're getting proper circulation because you felt it. And a lot of patients I'll inject and they'll feel it maybe a bit more towards the inside of the leg, but they barely feel the needle. So that definitely points an area that's not getting very good blood circulation. And in some patients even you'll touch the skin and it's just cold.
Really?
Yeah, you see that a lot in cellulite circulation. So, and then as we do more and more treatments, even the patients start to they start to notice that, geez, my legs feel warmer when I touch my skin. So,
oh wow, good stuff.
It is.
So if you would like to find a naturopathic doctor to work with you on your weight loss program or to treat cellulite, you can find a practitioner through the special button on our website, www.vitaminjunkies.com.
And while you're there, please sign up for our weekly podcast and join the addiction.
And lastly, while you're there, check out the show notes. You'll see a link to a survey. We want to get to know our viewers a little bit better, where you're from, and what you're interested in, and we'll use this information to help us prepare for future episodes. Thank you so much for joining us today. I'm Jennifer Lyle.
I'm Dr. JJ.
And continue the addiction to good health.
Do, 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 do. Do, 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 do. Do, 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 do. Do, do, do.